Welcome technicians. Today we look into how to see the results in our hematology instrument, both today's results and the older results which in the instrument. So we have to first and the foremost thing, we have to understand that it will remember at around 10,000 reports for the patients. After the 10,000 reports, it will start deleting the older reports and start adding the new reports. Okay. So instrument. So first and the foremost thing, come to the menu screen, and then you take the patient results. Once you take the patient results, there are about 4 icons are present. One is the work list, which is not important to you. Next is the results. Now these results and the results in the bar, in the right side bar, they both are one and the same. Okay, you can take the both buttons, they will show similarly only. Okay, so you click on the results button and it will give you that particular days all the results that are present. So first and the foremost thing, to identify these reports, you need to know the request number of the patient. So from the HIS, you have to check the request number, and based on that only you will be able to see the reports. Okay, so you click on the select the request number and you open it. Immediately you will get the results for that particular patient. Okay, now this is required. Why? Because many of the times a doctor might have asked only hemoglobin. Subsequently he may ask that I want to know the total count and platelet count also for that particular patient. So during that time, instead of rerunning the samples, you can just go back and check the previous for that particular patient, for that particular sample only, what is the total count and platelet. If an entirely new sample has been sent for a different reason, then you have to run the results only. Okay, run that sample again and get the reports. Okay, now if a particular patient's older reports, maybe 2 days before or 1 week before or a month before, such reports are asked, then you have to go to the archives. Okay, so you click on the archives. So in the archives, there are 2 options are present. One is the date result date from and the date to. So you may select, if you know the exact date, you select the exact date, or you can select 1 day difference between the two. So you click on this calendar button. Immediately it will show you the day, the calendar. You can select which particular month and which particular day, like that. Similarly, in the to calendar also you have to select, and once you select, immediately it will give you all the request numbers. So you select the request number, which so this request number you have to check it from the HIS and get the request number from there only. From there only you have to get. So without the knowledge of that, it will be very difficult to identify the patient. So the request number or the lab numbers are a must to identify which is the patient you want to check the reports. Okay, so you click on that, immediately the reports will get open, and as per that you can identify what are the report that is required, whether any extra things that are required for that particular patient or anything that has been asked, you can find out. Okay, hope you are able to understand this. Thank you.